Patients come to see me one of two main ways. Firstly, that they've seen a breast cancer surgeon within a week or 2 weeks beforehand and they're planning for a mastectomy, for example, and they come and see me so that we can potentially combine and do a mastectomy and reconstruction at the same sitting. The other way that it happens is there's a delayed presentation, months, years, whatever, after they've had their breast surgery, and they see their GP or they see a friend or someone who suggests you could do something about this, and they will come along in a far more composed and elective fashion than the former group. The people that really bring an insight for me are those that come back 2 years after they've had a mastectomy and they go along to a breast cancer support group and they see people with reconstruction and they discover that there's possibility, and they come in and they talk to me about the things that they've lost having had a mastectomy with no reconstruction. Capacity to wear bathers and feel even ability to wear a summer top or a t-shirt or the like, and not feel uneven, to be able to get changed in the bathroom and not feel like they're less of the female or less of the person that they used to be. And those things are extremely important to some people. Now, in contrast, you meet people who are extremely pragmatic about it, and a bit like living in a house with an average bathroom. They don't care what it looks like, they just want to be alive. And those people very quickly decide that they don't need the extra wear and tear of another set of surgeries to make them look even. But I will occasionally get those people some years later who just need a trim up of scars or presence, or even reducing the other side to make it closer to even, but we do nothing in terms of reconstruction for the side that's had the mastectomy. Basically, when we go through this, there's two main options. One is using an implant-based reconstructive process, and the other is using your own tissue. In both series, there's more than one operation to get a nice result. You may be lucky enough to get it with one operation. That depends on the sort of body, from my point of view, that I'm working with, and that decision process as to which way to go is based on the patient and who they are. And I do spend time talking about that. You know, are you a young mother? Do you have to live children? Do you have shopping? Do you have a job that requires you to be physical, to be mobile? Are you a sport player? Because you may choose not, for example, to take away one of their muscles for a reconstruction if they're going to use it every day of their lives. You then, once you've worked out a plan of the immediate reconstruction, we try and set a time plan so that people have an idea that it's going to take them 2 years to get to the final finish stage, or even 6 months, depending on what they choose to do. And then they have to have an understanding that in the middle of that may come chemotherapy or radiotherapy, so it could all get blown out. And I try and suggest to people that we take the next step when they're ready for it, because there are some people who have to get it all done as soon as they can, and there are some people who just need a break after their mastectomy or their chemotherapy and say, I'm going away for 2 years, I'm going to eat mung beans in the corner and feel good about myself before I've got the strength to make the next decision. And that's fine. There's no strict timing issue with reconstruction.